Hello. Welcome to this Health Enlightenment. I am Dr. Fernand. Let me guess, you might be asking, what is cardiopulmonary resuscitation? And that's beautiful, please let me explain. Cardiopulmonary resuscitation is an emergency life-saving procedure, performed in emergencies, such as heart attack, or in people who are drowned in water, in which breathing stops. As a result, the heart stops beating. Immediate CPR can double or triple chances of survival after cardiac arrest. The American Heart Association recommends starting CPR with a series of hard and fast chest compressions. Every year, about 350,000 people die from cardiac arrest in the United States. Now, why do we apply CPR? CPR can keep oxygen-rich blood flowing into the brain and other organs until emergency medical treatment can restore a typical heart rhythm. When the heart stops, the body no longer gets oxygen-rich blood. The lack of oxygen-rich blood can cause brain damage in only a few minutes. Keeping the blood flow active, even partially, extends the opportunity for a successful resuscitation once a trained medical staff arrives on site. The American Heart Association uses the letters COB to help people remember the order to perform the steps of CPR. The following are the respective meanings of the letters. C stands for compressions. A stands for airways. B stands for breathing. And it is CAB. Now, what are the importance of these compressions? Basically, it restores blood flow. Compressions means that you'll use your hands to push down hard and fast in a specific way on the person's chest. Compressions is the most important step in CPR. How do you perform cardiopulmonary resuscitation? For adults, put the person on his or her back on a firm surface. Kneel next to the person's neck and shoulders. Place the lower palm heel of your hand over the center of the person's chest, between the nipples. Place your other hand on top of the first hand. Keep your elbows straight and position your shoulders directly above your hands. Push straight down on the chest, at least 2 inches, that is, 5 centimeters, but should not be more than 2.4 inches, and that is 6 centimeters. Now use your entire body weight, not just your arms, when doing compressions. Push hard, at a rate of 100 to 120 compressions in a minute. Allow the chest to spring back, recoil after each push down. Note, if you have not been trained in CPR, continue the chest compressions until there are signs of movement, or until emergency medical personnel takes over. But if you have been trained in CPR, go on to the opening of the airway and rescue breathing. To perform CPR on a child, there are almost the same steps, just as in adults, but with the following few differences. Place 2 hands, or only 1 hand if the child is very small, on the lower half of the child's breastbone or sternum, to perform CPR on a 4-week-old baby, or older. Note, same steps, as in adults, with the following difference apply. Place the baby on his or her back on a firm, flat surface, such as a table or floor. Imagine a horizontal line drawn between the baby's nipples. Place 2 fingers of one hand just below this line, in the center of the chest. Gently compress the chest, at about 1.5 inches, that is 4 centimeters. For airway, open the airway. If you're trained in CPR and you've performed 30 chest compressions, open the person's airway using the head tilt, chin lift maneuver. Put your palm on the person's forehead and gently tilt the head back. Then with the other hand, gently lift the chin forward to open the airway. For breathing, breathe for the person. Rescue breathing can be mouth-to-mouth breathing or mouth-to-nose breathing, if the mouth is seriously injured or can't be opened. Current recommendations suggest performing rescue breathing using a bag mask device, with a high-efficiency particulate air HEPA filter. After opening the airway using the head tilt, chin lift maneuver, pinch the nostrils shut for mouth-to-mouth breathing and cover the person's mouth with yours, making a seal. Prepare to give 2 rescue breaths. Give the first rescue breath, lasting 1 second, and watch to see if the chest rises. If the chest rises, give a second breath. If the chest doesn't rise, repeat the head tilt, chin lift maneuver and then give a second breath. 30 chest compressions followed by 2 rescue breaths is considered one cycle. Be careful not to provide too many breaths or to breathe with too much force. Resume chest compressions to restore blood flow. As soon as an automated external defibrillator (ED) is available, apply it and follow the prompts. Give one shock, then resume chest compressions for 2 more minutes before giving a second shock. But if you're not trained to use an ED, contact the 911 operator or another emergency medical operator who may be able to give you instructions. The following are to be avoided while performing CPRM. 1. Minimize interruptions in chest compressions. 2. Provide compressions of adequate rate and depth. 3. Avoid leaning on the victim between compressions. 4. Ensure proper hand placement. And 5. Avoid excessive ventilation. High-quality CPR should be performed by anyone, including bystanders, and if you follow these steps accurately, you too can save a life.